So you've done laser hair removal, completed your treatment, and now you're concerned that your hair is going to come back, or you've heard that the hair is going to come back. Let's talk about it. So whenever somebody comes into the office for a consultation for laser hair removal on the face, the first thing that I make sure that they understand is the fact that facial hair, thick facial hair, is not normal. Okay, so it's hormonally driven. And so the bigger problem that we have is that we need to manage the hormones. Okay, so for some people, the hormones are triggered by PCOS, and for some people, it's basically genetic, and for some people, it's hirsutism caused by insulin resistance. So if you're pre-diabetic, it can actually cause you to have facial hair. This part is the most important part because it helps people understand what to expect with laser hair removal. Laser hair removal's job is only to take care of the side effects of the problem, which is a hormone causing the hair to go from thin to thick. So once everybody understands that, we don't only make a plan for hair removal to sort out their skin, we also make a plan to help them with their issues in their bodies. So we talk about food, we talk about exercise, we talk about stress reduction, because all of those things will trigger the hair to go back from thin to thick down the line. So, as an example, during the pandemic, a lot of people developed hair growth after they had completed their treatment because they were going through periods of stress. Another period of stress could be things happening at work or pregnancy, for example. And so, because this hair is hormonal and it's really difficult to manage a person's hormones, once they've completed their treatment, so let's say it takes 6 to 8 treatments to get them to maintenance, then I encourage them to continue doing maintenance treatments. And this varies for different people. Some people, the second year of treatment is like 4 times a year, and then the third year is like 2 times a year, and then the fourth year it's like 1 treatment a year. But you always have to touch on those hair follicles because you don't want them to go from thin to thick again in the event that you go through some stressful period, or something happens and you gain weight, and so then you have insulin resistance, and then that triggers androgens, and then that triggers the hair growth. Like, that's the cycle that happens in patients who have insulin resistance. So you have to take care of your body, and then my job is to make sure that the machine reduces the hair, improves the texture of your skin, and also improves the tone of your skin. So the hair only comes back if there's something majorly going on, especially with their hormones. So always keep that in mind. And I tell my patients all the time, it's all about expectations, okay? So what are your expectations when you're coming for laser? Do you want the hair to go away completely? Well, I can't promise that, right? Because laser only does 80%, and then 20% of the hair is dormant. But if you want hair removal mostly, and you want improvement in the texture of your skin and skin tone to improve, then I recommend laser, because laser is able to do 3 things as opposed to something like electrolysis, for example, that is really good at removing the hair, although it takes a really long period of time, but it will remove the hair. But it doesn't tackle the scarring that comes with hair, ingrown hairs, and it doesn't tackle the pigment. Okay, and in a lot of cases, it can actually do more damage in terms of the texture of your skin. So it's all about managing expectations and knowing what your goal is. And then once you know the goal, then we can come up with a treatment plan that makes sense. So for me, it's not just hair removal, it's also taking care of your body, helping you lose weight, helping you make good choices for your food and all of that, so that your hormones stay balanced and we don't develop rebound effects and get more hair growth. So I hope that was helpful.